Well, you may have heard about the World Health Organization's so-called pandemic treaty, or as it's officially titled, the International Treaty on Pandemic Prevention, Preparedness and Response. Member states of the WHO are set to negotiate with the WHO about this agreement between member states, including Australia, and the WHO about future global health emergencies such as pandemics and how they are to be handled. Well, the WHO says this treaty will provide the framework for a more coherent and coordinated response to future epidemics and pandemics. And the assumption seems to be that sovereign nations are unable to handle emergencies for themselves. Well, here's how I see it. The pandemic treaty represents another step in the incremental ceding of sovereignty to unelected United Nations bureaucrats and those in executive government. For example, Article 7 of the treaty says that the WHO shall conduct regular social listening and analysis to identify the prevalence and profiles of misinformation, which contribute to design communications and messaging strategies for the public to counteract misinformation, disinformation, and false news, thereby strengthening public trust. Now, the question has to be, who defines what constitutes misinformation, disinformation, and false news? The notion that COVID emerged from a Chinese lab was, in fact, once considered to be a conspiracy theory, as was the notion that lockdowns were uncalled for. And indeed, the WHO really got many things wrong in the early period of the pandemic, so why is our government not pushing them on this? Furthermore, the WHO was initially unwilling to critically examine the Chinese government's role in the COVID outbreak and has been strangely uncritical of China in general. Article 15 states, the parties recognise the central role of the WHO as the directing and coordinating authority on international health work and mindful of the need for coordination with regional organisations, entities in the United Nations system and other intergovernmental organisations. The WHO Director General shall, in accordance with terms set out herein, declare pandemics. It's worth remembering that the WHO is a United Nations agency, so the pandemic treaty essentially bricks the concept of the UN directing and coordinating not just global pandemics, which they may declare, but international health work. It's all rather vague, but we see a shift away from sovereign nations directing their own responses to and preparations for public health emergencies towards the United Nations consolidating control. Simply put, why can't Australia or Australian state governments, for that matter, handle any future pandemics our own way? The concerns don't end there, as the treaty document states, each party shall build and strengthen its country's regulatory capacities and performance for timely approval of pandemic-related products. And in the event of a pandemic, accelerate the process of approving and licensing pandemic-related products for emergency use in a timely manner. Well, it goes without saying that pandemic-related products would include vaccines. So here we have a possible provision for accelerating vaccine development should another pandemic occur. Apparently the COVID-19 vaccines weren't developed quickly enough. The WHO is an organisation that, to put it mildly, performed poorly during the COVID-19 pandemic. When millions of people across the world were locked indoors in early 2020, the Director General said countries needed to find every case, isolate every case, test every case, care for every case, trace and quarantine every case. We should be seriously reconsidering our relationship with the WHO, not rushing to give them more authority in international law. The government is telling us that the WHO is not going to override Australia's decision-making capacities regarding public health. Sure, international law is complicated, and it's not as though the UN would simply be able to declare a lockdown and there would be nothing we could do. But the point is more basic. Why are we entering this treaty at all? Why is the WHO, and by extension the United Nations, considered such an eminent authority given how much they've got wrong? Why is the government throwing its weight behind the concept that pandemic-related products may require even quicker approval, as though Big Pharma needed more influence over our medical industry? Why are the Australian people being kept in the dark about this seemingly critical decision-making process? Who in the Australian government is scrutinising the WHO's proposals and making these decisions? Overall, this treaty is hardly democratic. These questions deserve answers, and they are the questions that many who've been impacted by the pandemic restrictions are asking. I'll continue to raise them in our nation's parliament, you can be assured of that. Now, if you've enjoyed this video or found it useful, please consider liking it and sharing it with your friends and family, as my content is getting hammered by social media algorithms. As always, thank you for your support.